from Jakarta School of Prosthetic and Orthotic. My name is Putri Sabrina.
And my name is Inasya Putri. So today we're gonna perform about the assessment, which is the special test and also how to test the muscle strength in the hip and also the trap. So let's get started.
So now I'm going to test for the Trendelenburg test. It's aimed for test the hip abductor muscle. First, we ask the patient to standing. Mbak boleh berdiri? Berdirinya belakang kamera ya. And first, we check the pelvic level. Maaf ya Mbak. After that, if we want to check the right side, then we ask the patient to lift the left side. Mbak, boleh nanti kakinya diangkat kayak gini, satu sebelah kiri. Oke. Turunin Mbak, boleh. Lagi, naikin lagi. Okay, so for this patient has a negative sign of the Trendelenburg because when the patient lift up the left side, boleh dinaikin lagi Mbak. We see that the pelvic is still in the same level. But if the patient has a positive sign of the Trendelenburg test, it's when the patient lift up the left side, but the pelvic is dropped to the left side also. So for this patient, it has a negative test for the Trendelenburg test. So now I'm going to test the LLD or leg length discrepancy. So there are two ways. The first, the true LLD, and then the second is the apparent LLD. First, I will check the true LLD. And for the true LLD, we palpate the axis of the patient first. Maaf, saya pegang ini ya. And then after that, by the measuring tape, we put the measuring tape at the axis of the patient, goes through the medial of malleolus. And our found is 83, and we go to the swap side. I found also this one is 83, means that the patient has a negative test for the LLD, or the patient has no true LLD. And then we next to the apparent LLD. The apparent LLD itself, we test from the umbilicus to the medial malleolus. Mbak boleh ditunjukin udah di mana? Oke, maaf ya Mbak. For the left side, it's 88, and then we go to the right side. For the right side, it's also 88 for the apparent LLD. Means that the patient has no true or the apparent LLD. So now, I'm going to test the GALLEAZI test. It's when the patient has a differences at the true LLD, we want to make sure which bone is more longer. So first, we ask the patient to bend the knee in 90 degree. And we see from the sagittal plane which bone is more anterior. If the knee is more anterior, means that the femur is more longer. And we check from the coronal plane. If the knee is more higher, it means that the tibia is more longer. So now I'm going to check the Thomas test. It's aimed for check the hip flexion contractor. First, the position of the patient is supine, and then the examiner position is beside the leg that want to test. And then we try to put our hand at the lumbar area. And we ask the patient to maximally flex the hip and also the knee. And then we try to extend the left side because I want to test the left side. Mbak boleh dilurusin? So the negative side, if there is no gap between the lumbar and also the leg and the bed, it's for the negative side. for the positive sign, if there is a gap between the leg and also the bed, but the lumbar is straight, means that it's a positive sign of the Thomas test. Or if at the lumbar is there is a gap, but the leg is still extend, or there is no gap between the leg and also the bed. For the previous Thomas test, it's commonly checked for the amputee percent, but there is a way to check a hip flexion contractor for the non-amputee percent. So, the position of the patient still in supine position, but the leg is hanging. And then the examiner position beside the leg that want to test. And the test is same, the procedure is same. We try to put our hand at the lumbar area, and then we ask the patient to fully extend the hip and also the knee. Boleh diangkat dulunya, Mbak. After that, I want to check the left side, so I try to ask the patient to extend the left side. So, the negative side, if there is no gap between the lumbar and also the leg and the bed, but the positive side, if there is a gap at the lumbar area, but the leg and also the bed no gap, or if there is a gap at the leg and also the bed, but the lumbar is no gap.
Okay, so for the next assessment will be upper test. So the upper test is to checking if there is any iliotibial vein tightness or not. So the position of the patient will be lying side here, and the observer will be stand behind the patient leg. And here the affected side, or the one that we want to check, is on the up position, which is on the left leg. Here, how to do that? First one, we stabilize our hand, is stabilize the pelvic here, and then our other hand is below on the knee joint of the patient affected leg. And here we can flexing the patient knee, and then our hand is supporting the knee joint, and then we can extend the hip slowly, abduct, and then try to until that we will try to adapt the patient hip joint slowly, and then we can check again, extend, and then adapt, abduct, extend, and then adapt. So the positive side, if the patient not able to turn, like the knee joint cannot turn, it has indicate that the patient has tightness on the iliotibial vein. That's it. Alright, so for the next assessment, we will be for testing the muscle strength of the trunk flexor. So the position of the patient will be lying supine, and also the knee is flexed, and the observer will be beside of the patient. And here there are 5 grades for the muscle strength of the trunk flexor. For the first one, the grade 0 means there is no contraction at all, and for the grade 1 there is a flicker sign, and for the grade 2 means the patient able to lift up the head but the lumbar is remain flat. If for example like this, the patient able to lift up the head but the body is still of the bed. And the grade 3 means the patient able to lift up the head, the shoulder, and also upper scapula. So here for grade 3, and for grade 4 it is same like grade 3, but the difference is the scapula is completely off, like that. And for the grade 5 is same like grade 4, but the difference is the patient able to lift up the trunk while the hand is put behind of the patient head. So that is for grade 5 trunk flexor test. Okay, so for the next assessment will be the muscle strength for the trunk extensor. So same like the trunk flexor, there are 5 grades for the trunk extensor. For the grade 0 means there is no contraction at all. For the grade 1, there is a FLEXOR sign, and for the grade 2, the patient is able to lift up their head. Just only the head. And for the grade 3, the patient able to lift up the head and also the thoracic cage. Okay. And for the grade 4, the patient able to lift up their head, their thoracic cage until umbilicus. And for the grade 5, it's same like the grade 4, but the difference is the patient put the hand behind the head. Okay, so that is for the trunk extensor test. So for the muscle next assessment will be the lateral flexor test, muscle strength. For the grade 0, it means there is no contraction at all. For the grade 1, means there is the patient is attempt or try to hitch or like lifting their pelvic up, but it is not have a movement at all. But we can see the muscle is like tightening. But if in grade 2, the patient is the pelvic is like moving, but the knee is still straight. And then for the grade, that is for the grade 0, and for the grade 2, the patient will be do the test with the lying prone. And then for grade 3 until grade 5, the patient do side lying. So the patient in the grade 3 of the lateral flexor trunk, the patient will try to like pulling or like do the lateral movement, but the hand here is still remain straight. And for the grade 4, it is same procedure, but the difference is the hand is crossed. So like this. So in the grade 4, the hand is crossed. And for the grade 5, the same procedure with the grade 3 until grade 4, but the difference is the hand is put on the behind of the patient head. Okay, that's all for the test muscle strength for the lateral flexor.
So now I will perform the SLRT test or straight leg raise test. It's aimed to reproduce the pain at the back side and also the leg. It can be that we can determine the causes of that pain. So first, the position of the patient is in lying supine, and the examiner is beside the leg that we want to test. And then first, we try to grip the above the ankle at the leg, and we try to dorsiflex the ankle, and we internal rotate the hip and also adduct the hip, and then make sure that the knee is in extend position, and we lift up the leg, and it stop until the patient feel its pain. So the positive side, if the patient is pain at 30 degree, means that the patient has spondylolysis. If the patient feel pain at the 30 until 70 degree, means that the patient has a destination at lumbar 4 and also sacrum 1. But if the patient feel pain above 70 degree, means that the patient has hamstring tightness.
For the next assessment will be a forward bending test. So this test is to see if the scoliosis either it is functional or structural. So the position of the patient will be in front of the examiner, and the examiner will be behind of the patient. Okay, so ask the patient to lift up the hand, and then the hand should meet each other, and then for our observer will try to stabilize the pelvic first. Alright, then after that, ask the patient to slowly bend the trunk until the maximum bend the patient can do. Alright, So the sign of the scoliosis are if there is a hump or like a area that is like higher or lower than the other side, which is like here in the scapula and then in shoulder. And if there is a hump, it is indicate that the patient has scoliosis. And we can ask the patient to rotate where the hump is the higher one. If, for example, the hump is happen on the right side, so we can ask the patient to rotate the trunk to that side. Alright. So if the patient during rotate the trunk and the hump is disappear, it means the scoliosis can be corrected or functional. But if during the patient is rotate but the hump is still remain, it is indicate that it's possible that the scoliosis is structural or fixed.